My name is Tedisai Colleen Marigere. I'm from Zimbabwe. The main problems that we are facing as young people when it comes to sexual and reproductive health rights is low risk perception.
Hi, my name is Adam Staibat Onize, the National Youth President of Planned Parenthood Federation of Nigeria. We have lots of SRHR challenges in Nigeria and within our communities. One of these challenges is lack of access to contraceptive, which has led to a wide range of teenage pregnancy. Many individuals, especially in rural areas, lack access to a wide range of contraceptive methods. Barriers to access include cost, distance to health facilities, stock out of contraceptive, and cultural or religion opposition of family planning.
Hello, I'm Christabel. Service providers are very slow. You spend a lot of time at the hospital. You might get there in the morning and go back home in the afternoon.
My name is John Murage from Pathways Policy Institute, here with various issues affecting SRHR, or rather the sexual reproductive health rights. Number one is gender-based violence. Young girls and young women are vulnerable to various forms of GBV, like the sexual assault, forced early marriages, which can have a profound or long-lasting physical, emotional, and social damage. We have teenage pregnancies. Early and unintended pregnancies can have profound consequences for the young adolescents, including increased risk in mortality rate, school dropouts, especially for our young girls. Then we have limited opportunity for personal development, which really is affected by the early or the unintended pregnancies.
Obedience Mazenge is my name. One of the major challenges is restrictive environments or restrictive policies or laws in terms of access to sexual and reproductive health services. The other challenge is also the implementation of the already existing policies or laws, or lack of funding in terms of implementation of the already existing policies. The other challenge is limited inclusivity or limited inclusion of persons with disability, be it on policies, and we also have a challenge in terms of youth-friendly environments and youth-friendly services.
Common challenge in SRH should be unfavorable cultural, societal, and religious norms and beliefs in diverse settings. These have ultimately led to a primary problem of inequitable access to sexual and reproductive health information and services. For example, even though same-sex relationships have been decriminalized in most African societies, gender minorities may still find it very difficult to promptly access essential health services due to the exacerbating stigma, discrimination, and even death in worst scenarios. Let us look at the case in Ghana currently. An anti-homosexuality bill has been passed in February. It imposes jail time to those that identify as LGBTQI and those that advocate for. This creates a secondary problem of infringement to basic human rights of health, freedom, and privacy. This issue is similar to that of abortion, even though it may be somewhat controversial.
Hello, so I'm Anot Dachome from Zimbabwe. So one of the challenges that I as an individual, I as an adolescent girl or young woman is facing is that we don't have money. We lack money to buy sanitary wear.
STIs and HIV and AIDS, especially the young adolescents, are at a higher risk of contracting STIs, including HIV and AIDS, due to early sexual debut, multiple sexual partners that affect or expose them to the things that affect SRHR. We have challenges that rather face the SRHR, the young adolescents, and we have stigma and discrimination, especially when they go to get the contraceptives thing and everything. They're so stigmatized and discriminated. Then we have the legal policies and the restrictive laws to age of consent, to contraception, to abortion, LGBTQI rights. These all can limit access to SRHR. Cultural and religious beliefs. Different cultures, different religions have different ways that affect, or rather can limit, the access to SRHR. Then another thing is the digital influence and risk. The pervasive influence of the social media can expose the young adolescents to harmful content, cyberbullying, and all things.
Parents find it very, very hard to talk to their children on sex education. They try to shun their curiosity whenever they ask questions pertaining to sex. You see them asking them to go inside when a scene comes up on TV. I think this is the problem in my own community, because when you're not guiding your children, when you're not informing them when they need that information from you, they tend to go outside and get unguided information that can actually do a lot of harm better than good. But when a child comes to their parents, for example, a daughter talking to her mother and a son talking to his father, and they give you the needed information, how to abstain, how to protect yourself, and the likes, it is way more better than getting unguided information. And the curiosity to know what's in it, want to know more, would actually do them more bad than good.
The challenge that we're facing as my young women and my adolescents and youth here in Zimbabwe, or mostly our community, in my contraceptive, but we cannot have contraceptive. Just because she's not educated enough to know more about contraceptive. I think plus there's this, there is no sex before marriage again. When it comes to abortions, even in our churches, abortion.
So the largest problem we have is lack of information and knowledge on existing health rights and health services that attain to sexual and reproductive health. We also have an immense problem of lack of funding in certain sexual and reproductive health sectors, such as menstrual hygiene and even contraception, and there is a lot of stigma and misconception on certain things. For example, young people in campuses think that if you take contraception, you are promiscuous and you are generally a bad person, or that they have a direct effect on your fertility and that you become infertile and can never have children before. So this is a huge problem we face with our young people that we work with.
Hello everyone, my name is Panashima Kusha and I'm from Zimbabwe. So the challenge that I and my fellow peers are facing in relation to SRH in intergenerational relationships, we are finding that most girls probably men of older age for money, because vazhinji vavasikana havana mari and they don't work kazhinji kacho handiti. So pakudana vanhu vakura apapa havapiwi mukana wekuita negotiate for safe sex. Munhu mukuru anokwanisa kuvaudza kuti I want sex, then vanokwanisa kuita unprotected sex, then pa-unprotected sex apapa vanotapurirwa zvirwere zvakasiyana siyana zvatingati nedzimwe nguva ma-STIs, sexual transmitted infections, vana gonorrhea, drop, vana herpes and stuff handiti. Then vaita zvirwere izvi chinozonyatsa kuratidza nchokuti vanozobva nezvirwere izvi kune vanhu vakura madhara ava, vouya kwatiri isusu vakomana vezera ravo vadiki kwatiri, kubva vatipomera zvirwere izvi handiti. Saka chirwere che-STI chinoramba chichitapurirana from one person to the other, from one person to the other.
My name is Ruth Namnyak from Pathways Policy Institute. One issue in particular is access to information, because some of these young adolescent children are not able to access accurate and good information on issues on SRHR and reproductive health. Also, another issue is access to their health services, due to costs sometimes, and also confidentiality among their community members. They are not able to go to the health services to acquire the services that they may require, especially on issues on STIs and HIV/AIDS testing. Another issue is unwanted pregnancies. Some children, due to the early marriages, or maybe sometimes getting into sexual things very early, they end up getting pregnant, and they actually affect their economic situation because they're not able to take care of the kids. Another issue is STI and HIV infections. Sometimes, since they don't know that there are some contraceptives that can protect them from getting the HIV, they are not able to protect themselves, so then they get the HIV and some STIs.
Good day, ladies and gentlemen. I'm Conte Fodisise, member of the Youth Action Movement Sierra Leone. One of our challenges have been finance, because we want to reach all the four corners of Sierra Leone, and also another challenge we have been faced with is how we can able to have a youth-friendly center where we can able to engage young people about the issue of SRH.
Hi, I'm Betha from Zimbabwe. Challenge pia tinosangana nayo patinoenda kumwedzi as girls. Atina vekuudza kuti ndiri kugwadziwa kana ndiri kunzwa mapains, because vazhinji havakwanisi kuzvinzwisisa, especially our opposite sex, and tinosekwa tiri kuchikoro. Mostly kana ndikatoinzwa ndiri kuchikoro maybe zvinenge zvangosvika ndisina kugadzirira, unosekwa. At the same time kwasa kutonzwa munhu akutokuseka kuchikoro oro vanhu vakutokuseka but ndaenda ndisingazivi. And then also andinawo kuudza kuti ndiri kunzwa chakati, ndiri kunzwa pakati, and kuti udze munhu kuti uri kuzvinzwa sei hawakwanisi kuzvinzwisisa, because havafeel the same pain or the same feeling yatinofeela kana tiri kuma-periods. And also for example, I can say I'm living with my stepmom. Sometimes andikwanisi kuva ndinogona kutaura kuti chakadai andina kana paid or ndazoenda ku-period this time, unokwanisa kunyararirwa kana kusatonzwisisiwa. But dai zvaibvira tawana munhu wekutaura naye, maybe tingova free kutaura even to our fathers, to our mothers, to our closest friends, our guidance as my young adolescents, because we need that help.
Some of the sexual reproductive health rights issues affecting the adolescent and youth programs are lack of access to comprehensive sex education, limited access to contraceptives and reproductive health services, cultural and religious barriers. Some of the possible challenges to this are inadequate funding, lack of awareness, and gaps in healthcare infrastructure.
As young people, we need as much information around sexual reproductive health dangers and information that we need to know so that we can make informed choices and informed decisions and not judge just by looking at people, looking at situations, but make decisions that are based on facts, that are based on truth. Thank you.
I think our service providers should put more staff and be more efficient, and the processes take long. You see this person, you are direct to the next person, direct to the next person. If it's possible, just it should be a one-stop station. You just deal with one person, then throughout, then if you finish that, then you go home, because they take too much time directing you from this person to the next person.
We need laws that are inclusive. We also need laws not to be restrictive in terms of access to services by adolescents and young people. And we need funding. We need funding for already existing policies in terms of implementation.
So I propose if we could get sanitary wear for free, the same way condoms are being just offered in hospitals and stuff for free.
We want them to be educated more on abortion, more on contraceptive, more on us accessing services as my youth.
My proposed solution to this, ndingangoda kuti dai kwaitwa know your service campaigns akawanda, so that vana vechisikana ava can be capacitated with information yakakwana, kuti kana wasvika panguva yakadaro we know kuti isusu tinofamba nedonzvo rekuti abstinence is key. Sex inongozodayo kuitwa sex kana madi vanhu varoorana matestana mose nemhuri yako maona mese kuti ya negative, then mozoita unprotected sex michigadzira vana venyu. But then kana mazosanganawo nenguva yekuti hapasina kunegoshita kana kuti chivapaiwo mukana wekuziva kuti kune chichonzi condom, vawanewo information yakakwana. Know your service campaign aya anokwanisa kuvabetsera kuti vaone information yekuti kunopfekwa condom, kune anonzi maprep, kune anonzi mapep handiti. Uye futi vakaitawo makampeini ekufamba pamagrosa aya vachiudza vana kuti tinawo makondomu anopiwa mahara, tinawo futi kune futi reusable pads, mukwanisa kuvabetsera futi nemanyaya dzemakampeini idzodzo. ndo I think those are ngotsara zwe.
Our suggested solutions to these problems are to have better education. This is an area that really requires a lot of investments to have better education for these people, and to ensure that we debunk the myths and misconceptions about sexual and reproductive health, as well as better funding for these avenues.
With the help of FP 2030, we can able to combat and achieve the goal of the sexual reproductive health, so that the status of young people will be safe and safer.
Addressing this issue requires comprehensive strategy that prioritize access to healthcare services, education, and empowerment of women and girls to make informed decisions about their reproductive health. I want to use this medium to encourage our viewers to advocate for better SRH policy and support any initiative that promote access to healthcare and education. Thank you.
A multi-sectoral approach whereby it involves the government, civil society, and community can be used in order to address this.
Now, relating to SRHR interventions, this is a root-level challenge which requires a multi-sectoral approach, with more emphasis on strengthening advocacy and legal systems, such that the voices of these vulnerable populations are heard loudly and clear, despite their defining characteristics.
I feel the solution to this should be educating the parents on how to bring this conversation in a comfortable manner, and that the children will be interested in listening. I think they should learn how to bring this conversation up at a matured age, so that the children would still be able to listen to their parent before they've grown all wings, and then they tend not to listen anymore because they attain the particular age that topics like that are not even new to them anymore. My name is Esther from Planned Parenthood Federation of Nigeria, Lagos chapter.
Hello, my name is Faith Obunga, Organization Pathways Champion, Cohort 5 from Kenya. I am excited to attend this year's conference as I strongly identify with the theme, Priorities for Advancing AYSRHR in Africa. Whereas adolescent and youth sexual and reproductive health and rights is a global issue, there are some unique challenges and opportunities that exist in the motherland that need to be explored. The RHNK conference provides a unique platform for this. Moreover, the conference will present an opportunity to learn from industry leaders and experts, to network and build meaningful connections. I'm also excited because this year I get to present my abstract at the conference, so I can share my knowledge and get perspectives from others.
And I am eager to see how various stakeholders approach the SHR, either through policy, technology, education, or even through community empowerment. I'm ready to learn. I'm ready to see how this is able to being approached and being achieved.
As the 7th RHNK Annual Scientific Conference approaches, we as adolescents and young people, we look forward to our voices and demands being met, our abstracts being listened to, our SRHR needs being acknowledged and prioritized. We look forward for action. We look forward for change. Until then, see you there.